is for all patients.
Allow me to just recap so that I'm sure that I got you right. You said NHIF went down because there were 30 billion shillings in debt, right?
Yes.
Here we are, we have spent 104.8 billion shillings on a system. You claim that the multiple schemes were in NHIF, and here we have enhanced health packages on SHA. Why not? Because if you're using 104.8 billion, yet on this other hand, you had 30 billion, the math is not making sense. If there were all these schemes and all these issues, why not streamline rather than come up with a new scheme altogether?
Okay. So first of all, you should understand that NHIF scheme was corrupted, all right? So there were people who could be able to hack in and make some crazy, transactions or remove money from the system, all right? So it was not stable. It had people who had learned and understood the system. And you can talk to a few doctors and you'll really listen and understand what they are saying. Because what someone would have to do, a healthcare worker, is just, talk to someone who's inside the NHIF and tell them, or maybe the one who's inside is saying, let me send you 200 million, give me my 20 million, and then try and figure out the accounts.
So why not clean up the mess then?
And so when you look at this system, it is the digital health superhighway. It has multiple components with the health information exchange system. One of them being the patient, the patient portal that will look at the patient journey. Once the patient enters the room, once they take their vitals, you can always have a chart of their vitals, and again you'll have the examination, what medications they've been given, and then the claim goes to social health authority. So you can see the patient's journey, and this is historical, you see, and then you can use the same, it's interoperable, so you can use it in any facility, in any county, so you don't need to carry all those things. Secondly, it has the health workers register. So we need to ensure that all health workers are licensed, okay? So that improves quality. Again, it has medications, okay? And again, the healthcare facilities, ensuring that each one of them has been assessed, okay? And, and is capacitated on that level of care,
okay.
All right? And again, it has the ICHIS, which is the, community health information system, all integrated. Again, surveillance, at times you may have an outbreak. How fast can you pick it? You can have, right now there was recently a diarrheal disease in Kisii. We need to pick these things promptly as
I don't know,
health
CS,
experts.
once again, if I may cut you short.
Yes.
Have you interacted, perhaps you were not feeling well just the other day, last week. Did you interact with this SHA? Did you experience the delays that, normal Kenyans do experience?
Yes, and let me tell you something, Ashley. Delays can occur. Even when you look at the systems, the finest systems in UK and US, yourself, even when you have your mobile banking, there's some delay.
But this
there's
is
some
your
internet.
life you're talking about.
And so what we are saying, if the system is not working, we're not saying health service provision is stopped because of a system. No, not at all. You can use hard copies. You can also have, the information out there, and then you can put it in once the system is up. So we are saying no Kenyan should be denied health services because of a system. But this system must work. You know why? Because once the system works, then we'll be able to avert corruption in the country. And seeing that it was a nationwide, rollout, and again, seeing that the systems, again, as I said, you can have interruption. And it's not unique. Even for systems that have been there for many years, there's a time when they tell you, please, wait for a few hours, we are going to configure, we are going to work on it, etc. Because you need to build it.